Meningitis case 12 and 142. Our first patient is a 3-year-old girl, Daniela G. She's been showing symptoms of high fever, headache, vomiting, and sleepiness. She has a history of ear infections, and when we performed a physical exam, it showed that her ear canals were inflamed. This led us to believe that she had bacterial meningitis. A cerebrospinal fluid analysis test was taken and showed that her neutrophils were higher than the normal range, her glucose levels were lower than the normal range, and the protein levels were higher than the normal range. In order to figure out which virus caused her meningitis, we sent in a stain test which showed that lancet-shaped cells, Diplococcus, and short-chain cells, and gram-positive. We also requested the culture media test and got positive for Streptococcus pneumoniae in the nutrient agar, blood agar, and the chocolate agar. For macaque agar, Martin agar, and the blue agar, we got Streptococcus pneumoniae negative. So in order to confirm the diagnosis, we requested a biochemical quelling test for the Streptococcus pneumoniae. The results were that the capsules became opaque and enlarged. This is a positive result, which confirms that the diagnosis, the cause of this meningitis was Streptococcus pneumoniae, and treatment for the severe cases are penicillin G, and the milder cases is oral amoxicillin. Prognosis for this is that after taking the antibiotics, recovery period is around 7 days, and no isolation is required. So our second patient is Kim T, a 13-year-old boy. He showed symptoms of headache, fever, rash, light sensitivity, and neck pain. Because of the symptoms, we believed he had viral meningitis, and a cerebrospinal fluid test analysis was also taken, which showed that the neutrophils were a little higher than the normal range, glucose levels were within the range, and the protein levels were a little higher than the normal range. In order to confirm the diagnosis, we requested a serology test for Coxsackie virus and echovirus, which are two of the main causes of viral meningitis. So for IgG, we got negative for coccivirus. IgM, we got positive for coccivirus. For echovirus, we got IgG negative and IgM negative. Because we got IgM positive for Coxsackie virus, we know that the diagnosis was Coxsackie because IgM means that there is currently Coxsackie virus in the body. Because it's a viral meningitis, there's no treatment. So instead you can try rest, drinking lots of water, and pain relievers help. The prognosis for this resolves around 7 days. No medical treatment is needed, and because Coxsackie virus is highly contagious, we suggest isolation.